Welcome, everyone. Dr. Shane Morris here, and I'm joined by Dr. Chrissy Sutton, and we are so excited to present to you some information about vaccines and how to prepare for them, because regardless of our personal take on the situation, you're going to have a number of clients that are going to either get the vaccine and or want to get the vaccine. And in both cases, we have some really amazing tools that we want to teach you today regarding pre-vaccination or post, or both for that matter. And everything is centralized around the immune system. In fact, what you're going to learn today is so important, not just for any current issues you might be concerned about, but even issues with children and forthcoming vaccinations that certainly will be in everyone's future. So I'm excited to present this, and I'm going to let Christy introduce the subject to you.
Hi, Dr. Sutton here. Thanks for joining. So regardless of what you think about vaccines, chances are good that you will likely be getting one, or that somebody that you are close to will be getting one or more in their life. So the questions that we want to address today are, how do we make sure that those vaccines are safe, meaning that you will not have a bad reaction? So that's very important. You want to make sure that your immune system, your health is ready for that vaccine so that you will, one, not have a bad reaction that could be hazardous to your health, and two, to make sure that the vaccine is going to work, meaning that you're actually going to have a response and your body is going to create antibodies and T memory cells and have a long lasting immune response, so that you're not subjecting yourself to a vaccine and then nothing is happening. So this is a really important concept. We want to make sure that the vaccine is safe and effective. And there's many things that you can do in your environment to ensure those two things. So one of the really interesting facts that I think we should start out with is that flu vaccines are estimated to only be about 17 to 53% effective in older adults. So I'm going to be talking about flu vaccines a lot. I know there's a lot of other vaccines out there right now, but the most research that we have to date is on older vaccines, such as the flu vaccine. So there's some newer vaccines like the COVID vaccine where there's some research, but we don't really have the long-term studies to give us really clear data. So we're going to be referencing some older vaccines, such as the flu vaccine. So if you have a patient who asks you, should I get a flu vaccine? Then say, okay, well, just so you know, they're between 17 to 53% effective in older adults. And let's talk about some things that you can do to, one, if you're going to get that vaccine, make sure that it's going to work. And two, make sure that you have a healthy immune response so that if the vaccine doesn't work, then you're still less likely to get the flu. And so let's go ahead and dig in. So the first slide is what can cause vaccines to be less effective. So there's a lot of different things here that can cause vaccines to be less effective. So being immune compromised is a really important one. So if you're on immune suppressants like steroids or biological immune suppressants, then, or if you're just really stressed out, haven't slept enough, nutrition deprived, then you're immune compromised most likely. And then you're more likely to not have as effective of a response, meaning that vaccine's not going to work as well. So that's really key. And there are a lot of things you can do about that, which we will talk about. Another key factor is age. So as you get older, your immune system changes. It becomes a little bit slower. It reacts a little bit differently. There's more inflammation, and the immune responses that you have against viruses or vaccines, they change, and they change in a way that you have less of a response to that vaccine. Having said that, also, if you're too young, then a vaccine might not have much of a response. And I'm going to show some data on the measles vaccine in a couple slides. But basically, when you're born, your body is not making the antibodies that you really need to promote a vaccine-mediated immune response. And that's why it's so important that little babies get breast milk so that they get the passive immunity from the mother's milk. And so as infants grow up, then there's fewer antibodies in the breast milk because the infants start making those antibodies themselves. So we'll go into this in more detail, but you can vaccinate too young. Now, in our society, that's not something we really like to talk about because, our current medical guidelines are suggesting and recommending that infants get vaccinated on day one of their life with the hepatitis B vaccine. So one might ask, why is that? And one of the key reasons for that is because it's a lowest common denominator approach. So if an infant is born to a mother and the mother has hepatitis B and they get a vaccine on day one, then they're significantly less likely to get hepatitis B. However, if a mother does not have hepatitis B because they were not participating in activities that might cause them to have hep B, like needles and risky sex and exposure to blood, then they will not give that infant hepatitis B. So many people will choose not to get that vaccine for their baby on day one because they know with certainty that they do not have hep B, and so they're not going to pass it on to their child. Having said that, the medical guidelines are recommending that everybody get that vaccine because it's basically a one-size-fits-all approach, which here at Systemic Formulas, we're trying really hard. Shane, Dr. Morris, and Systemic Formulas are trying really hard to help people use the knowledge that is out there to create a personalized health plan. That's the way of the future. And at Systemic Formulas, they're not just talking the talk, they're walking the walk with the genetic testing and much more to come in the future. So that's we're going to talk more about that in a second, but I just wanted to mention that. Shane, I'd really like for you to discuss a little bit about the next item, the poor gut microbiome, since that's kind of your wheelhouse.
Yeah, one of the factors that influences our immune development, and as I look at each one of these subjects where we talk about nutrition, toxins like smoking, alcohol, sugar, or even other toxins like arsenic, dioxins, all throughout this list, clearly we're talking about an immune situation and the immune system itself. And when you're talking about, the age group, the immune system is continually educated by our gut microbiome. In fact, it not only educates immune cells specifically, but it trains the brain and its response. It also has very specific genetics. So your own human genetics are at play with the genetics of the organisms within you. There's this really elegant yet complicated story that really underlies each and every one of these. And I'm hoping that you as the audience and practitioners start to see the pattern of inflammation, immune suppression, and immune suppression, where we talk the first one, immune compromised. Everything below that subject has an impact on the compromisation of the immune, whether you're in constant chronic inflammation, that compromises the immune system. When you're not sleeping, when you're not in a healthy environment and relationship with your friends and your family and your spouses, etc., these all drive an inflammatory response. They also drive the immune response in a way that is detrimental, and that works in a bidirectional fashion. So with the gut microbiome, not only is it necessary for a proper immune response, it's necessary to maintain the lifelong immunity, which we all want, which we can all get through our interaction with these viruses. Viruses are not a new invention on the planet. They've been with us since the beginning. And so our immune system is really designed, but it's designed in part through these associations with your immune system, your gut-brain axis, your gut skin, and each and every one of those has a link to the gut microbiome. And there's a number of studies that were released recently as related to viruses and to vaccines, where compromised gut microbiome and how they compromised them in these studies is they gave a certain part of the population that they were studying antibiotics. And by giving them antibiotics, they destroyed some of the gut microflora. And in doing so, measuring the immune response, and it was severely inhibited by not having the microbiota in a really healthy state. Whereas the other group, who had a relatively healthy microbiota, responded much more appropriately, both immunologically as well as all the other roles that our central nervous system plays in immune, as our gut plays, et cetera. There was a number of really appropriate and long-lasting responses compared to the gut microbiome inhibited version. So, and it's not a trend that we've seen a lot, new. It's old. We've had sterile animals in laboratories for a long time. We understand the detriment to our body. So as you guys look at these challenges that we face, and each and every one of these is something that we've talked about, even Christy and I have talked about in multiple different ways, we have to address these in a very personalized way. You have to address the microbiome in a personalized way. You have to address the immune compromisation, whether or not they're on pharmaceuticals or otherwise. Each and every one of these stages has to be addressed. And so the overreaching goal today is not only to help you understand the necessity of each of these individual pieces, but the more broad concept that when we tell you that we want you to improve your gut microbiome, we want you to improve the microbiome because its relationship to your ability to deal with viruses naturally, as well as these vaccines, because the opposite side of what we're talking about today is the detrimental response, or the dangerous response that some people have that are either immune compromised, or they're full of toxins, or they're emotionally compromised. It not only doesn't work, but many of you have experienced patients who have gone the opposite direction, and it's become a very dangerous scenario for them. And it can create lifelong issues within their immune system when it's not ready and not provoked appropriately. So without getting into too much detail, the opposite side of this coin is actually quite important to also understand. There's the good side that we'll talk about today, in hopes that we'll prevent more people from suffering long-term effects, negative effects, I should say.
Yeah, absolutely. And, one of the, I think, interesting things about this list is that it underscores the importance of the state of your health in general, getting the vaccine. So the healthier you are, the better response you're going to have to a vaccine, but also the better response you're going to have to a virus or a bacterial infection or a parasitic infection, or for that matter, let's talk about other things your immune system goes after, like cancer cells and, toxins. So the healthier you are, this isn't just about, your genes, what genes you inherited. It's also about, are you obese? Because if you're obese, then, you can be vaccinated with the exact same vaccine as somebody who is not obese, and you will have a less of a robust response, which means you're going to be more likely to get that disease you were vaccinated for. So the state of your health is key for not just getting a vaccine, but just life in general. Sometimes we think of vaccines as kind of being it's the shield to protect us, but they don't always work as well as we'd like. And they work much better the healthier we are. So it's kind of, not quite fair like that, but that's how it is. That's how the body works. The healthier you are, the more robust immune system you will have. Also, the healthier you are, the less likely that you will get triggered to have a bad reaction, and autoimmune type reaction. So one of the things here, it says, females tend to have a higher antibody response, but more adverse reactions. So just because you have a high antibody response doesn't mean that you're home free. Females are often also more likely to have autoimmune diseases. So those things can go hand in hand. There's some good literature on association between females getting the Gardasil HPV vaccine and having flare-ups issues with lupus. So when researching the genes, which we'll talk about later, when researching the genes and vaccines, I couldn't find a lot of autoimmune genes related to adverse reactions. But that doesn't mean that they're not significant. It just means that we haven't found it clinically in the data. However, if you're a practitioner and you've been paying attention, then you can see that many of your patients might have issues with autoimmune diseases and bad reactions. So mothers who have autoimmune diseases are more likely to have kids with autism. And one of the theoretical triggers for autism is being exposed to toxins, some of those toxins of which are found in vaccines, like thimerosal, which is mercury, MSG, things like that. So we'll go on to the next slide, but this is really key as far as the state of your health is going to determine if you get a vaccine, if you get the effect you want from a vaccine.
And another way to think about those items in what we call common vernacular is all these underlying conditions we hear about all the time, these comorbidities. Even if you don't want to try to educate your patients in a very scientific way, every one of those you can see has been talked about probably incessantly regarding the comorbidities or the underlying conditions. And that's no longer a mystery. They're not just some accidental issue. There are issues that can be addressed in the proper and appropriate way. And that drives up the healthy of the immune system by dealing with these underlying comorbidities or these underlying conditions, which of course is critical for all of us who not only expose ourselves to virus, but also, those people that do choose to get a vaccine. Everything about what we're talking about today is to drive home the idea that you have control over your immune system, you have control over your health, which will lead you down a path of a much more successful and thriving life with all these organisms around us. Because the last thing I want to do is demonize microorganisms because they play such a critical role in maintaining global health. And to do that, we have to be healthy as part of this global ecosystem. And that's something that you can express to clients in a much more, pleasant way, as opposed to going through the science and maybe scaring them. It's certainly something I've done in the past. But here's some of the science. Speaking of that.
Two things that I didn't put on there that I probably should have put on the list was one is using Tylenol and using NSAIDs like ibuprofen. So if you use Tylenol, then, often people will take Tylenol or ibuprofen around the time of the vaccine because they get a fever. And the fever is a result of their immune system creating an immune response and the inflammation associated with that. So if you take Tylenol to reduce the fever, then you're also depleting glutathione, which is going to, increase your risk for health problems related to side effects from various adjuvants and decrease immune tolerance. And if you take an NSAID like ibuprofen, well, then you're also hindering your immune response. So those are things to also put on that list. So I just wanted to show this. I think this is an important slide that shows how if you're obese versus lean body mass, then if you're obese, you're just less likely to have a lot of fewer T memory cells, which means that if you get the flu vaccine or the COVID vaccine today, and 6 months from now you get exposed to that virus that you were vaccinated against, well, you're more likely to get that you're more likely to get sick from that virus because you don't have as many T memory cells. You don't have that long-term immunity, just simply from being obese versus being lean. And I think we're seeing a lot of, our current public health crisis is a result of high BMI in our country. And it's as much an obesity crisis as it is anything else, and just poor health crisis. So that's a part of it. Another part of it is that the other part of the slide shows that not only are you more likely to not have immunity, but you're going to be shedding that virus longer, which means that you're going to be a super spreader. So not only are the obese people more likely to get sick from a virus, but they're more likely to shed it longer. They're more likely to be infected with it longer, which means that they're more likely to have genetic variants, like what we're seeing with these genetic variants, which is a normal progression of a virus running its course through a population. Genetic variants come up. That's just part of it. They want to survive. And in order to survive, they have to adapt and they have to have mutations. And so there's no stopping that. That's just part of the virus surviving. But if you give a virus a obese or an immune compromised person, then they get to have more time to adapt and create more genetic variants. And that's exactly what we're seeing now. So if you've been following the news, there's some really good research on immune compromised people who are immune compromised in this specific case because they were taking an immune suppressant for an autoimmune disease, and they got sick with COVID, and they were sick for over 150 days. And they have documented that the genetic variants have started in this person who was immune compromised because they were sick with that virus for so long. Their immune system was so suppressed and it could not get on top of the virus that it just developed all these issues with more and more genetic variants because that virus was in there longer. So, food for thought. Shane, if you don't have anything to say in addition to that, I'm going to move to the next slide so that we don't go over our time.
Yes, absolutely.
Okay. So this is basically this is research that I want you to have to be able to understand and explain to people that the age of a vaccine matters. So infants, in this study, they looked at the measles vaccine, and if they got the measles vaccine at 4 months old, then about 50% of them had made antibodies. Whereas if they just waited till 8 months old, around 85% of them have antibodies. And that the antibodies decreased, meaning their immunity decreased faster if they got the vaccine earlier. So this just kind of echoes and reinforces what I was saying about thinking logically about the timeline of when you're getting vaccinated, whether you're, a child or elderly, the age matters. And I know personally, we chose a pediatrician that wanted a alternative vaccine schedule for this very reason. And so, it's just something to think about. So if you don't have anything to add there, I'm going to move on to the next one. Okay.
Nope. Good to go.
Okay. This is not a very good image, but it's a really important concept. This is illustrating with clinical data the effect that stress has on vaccine responses, but you could insert for the word vaccine, you could insert immune response because in this study, they're looking at the amount of interleukin-2 and the amount of antibodies that you have after getting vaccinated. And so the higher level of antibodies, then the higher level of interleukin-2, then the more of an antibody, the more of an immune response you're having. So they use caregivers for people that have a lot of stress. But, you could insert anybody else with stress into that caregiver category You could insert somebody with sleep deprivation, somebody dealing with a divorce, someone dealing with a death in the family, just, chronic stress, and somebody with a really challenging job. So people with a lot of stress have less of an immune response, meaning that they're not going to have as robust of a immune response, and they're more likely to get sick, either because the vaccine doesn't work or just because another virus comes around. So that's kind of what I wanted to focus on there. And then, Shane, if you can kind of kick off what we can do to help vaccines be more effective, then
and we can think of vaccines in other ways, in terms of, we want an actual immune response. We want to have our immune system upregulate all of the things that it does, and then have it naturally downregulate itself. So we want the immune response, and we want the immune resolution. In order to optimize that, there's a lot of energy that's going to be required by the body. There's going to be a lot of nutrients that are required by the body. There's going to have to be a healthy, happy microbiome. Your metabolism has to be in shape. So you have to have a good way to de-stress, as you saw from the slide before. You'll have to have an efficient way to maximize your sleep, wake cycles, everything that we really promote from a holistic lifestyle and a healthy lifestyle. These are all underlying, because if you don't get a robust immune response, it's something that you're going to likely end up with other issues regarding whether it be bacterial, fungal, or other viruses. And so this is something that we're trying to set people up, not just for today and what's going on today, but for tomorrow and the future, because we will go through changes. Our genes will be turned on and off as we manage this environment we're in. So one of the things we want to point out here is these are interventional, but simple interventional tools that we, of course, would use under multiple conditions. This happens to be one. Although vaccines are unique, as Dr. Christie said, they seem to be this black box that we don't necessarily study or get involved in oftentimes in this industry. However, because of the current situation, we felt like it was necessary to introduce, or at least talk about it in a real honest and transparent way, because I would more likely want you to create a robust immune system by not seeing everything as a deadly organism, but there's so many great organisms that help to protect you from pathogens. Although pathogens are an issue, all the other things related to your health, like your microbiome and your virome and your microbiome, these are all things that help you defend yourself and all of the brilliant genetics you have. And how do we maintain that? Well, we have exercise, we have, of course, mood, and certainly meditation, yoga, working on your relationships with people, because it really can be debilitating when your relationships are out of sync with each other. There's that, that's the argument for, we're currently not socializing, not interacting, and that can create a long-term impact. Now, short-term, everybody, there are certain parts of our population that want to be sequestered and, remain safe. However, long-term, we have to get back to being social creatures, because that's how we share all of these, not only physical interactions, but we share our bacteria, we share things that help protect us. Our day-to-day is no different than a baby getting breast milk. They're getting so many benefits out of the mom, but you get a lot of benefits out of the people that you surround yourself with, and you don't even know it, from their pheromones to their microbiome to their positivity in the world. It can drive you in a healthy place. And it's a place that I don't want us to go in a sterile way. Addressing the world by isolating and sterilizing is not a long-term strategy. It's a short-term. And we want to reverse that slowly, not irrationally or without being deliberate and conscious, but we want to do it. We want to get back to understanding that having a healthy input of food and prebiotics and probiotics, eliminating toxins from our world, or at least in a way dealing with the toxins. You're going to always be exposed, but you want to get your detoxification system working properly. And clearly that becomes an underlying condition that you want to deal with. And then if you got all the micronutrients that can be depleted. I mean, everybody recently, there's this trend of, the new salt, the salt from really cool lakes and really cool parts of the planet. However, these salts don't contain iodine. And we want to make sure that as we're getting a better salt, a better sodium chloride for our food, we've got to remember to also think about other elements that exist like iodine and zinc and selenium. And each and every one of these plays a role in our overall health, which of course dictates our immune health. But in the end, one of the goals is to get back to a place where our environment, our planet is not something we fear. Our fellow neighbors and people in our community isn't someone that we fear. It's someone that we embrace and want to be communal. And to do that, we have to do it correctly and of course safely for those people that might be at risk until they can become healthy, which is our job to reverse these issues using the tools we have so that everybody has a more robust immune system, which is how we've done what we've done, which is why we could travel around the globe and find new places to live on any continent. That's because we had healthy immune systems to allow us to adapt. And that adaptation is genetic as well as environmental. And those are the focuses we have here. And you can do that. Of course, I'm biased. I'm going to want to do it through supplementation as well as dietary and other activities like probiotics and prebiotics. But clearly, this subject has a place, and it's got a place. It's more important now to be talking about these issues than it was a year ago. And I think that's why we're here, because our choices are: we do it right, we get better, or we're going to find ourselves in this conundrum 5 years from now, 10 years from now. Our children might have to face this again, and we would be remiss and silly not to do this. So we want to do this right. And I kind of globally went over this slide, but that's kind of my take on the idea is we can prevent, just like we would teach our body to respond to any organism on the planet, we can teach it to respond to a vaccine appropriately in the same way, because a vaccine will give us, or it offers up a small picture of what the virus does. And so we can help cater that response in a healthy way, in an appropriate way, by doing what we're talking about today. I mean, we really can. We can really turn this around in general.
Yeah. One thing that people often ask me is, what do you think about this vaccine, or should I get this vaccine? And I'm hesitant to give people advice about that type of thing. But what I do is I like to give them the information to help them make an educated decision. And then I often tell people, what I do. So, for example, I don't get flu vaccines. If somebody asks me if they should get a flu vaccine, I'm not going to tell somebody not to, because if something bad happened to them, they then, blame that on me. But I tell them, I don't, and this is, why I choose not to. And I'm not just, me and my daughter, we're not getting flu vaccines, but I'm also not just throwing ourselves to the wolves. I'm making sure my immune system is healthy. I'm taking probiotics, vitamin D, vitamin A, zinc, making sure our gut's healthy, making sure that our inflammation's under control, making sure we're not eating too much sugar, making sure we're sleeping, making sure that we're getting regular exercise. In general, just making sure we're healthy, because it's not a matter of if we get exposed to something, but when. And part of us having a tolerant immune system and having a healthy immune system is being regularly exposed to things, viruses, bacteria. Our immune system, think of it as the muscle that needs to exercise. And if it doesn't exercise, then it will atrophy. So, but we want to do that in a way that is, controlled within our limits. As far as, if you have leaky gut, you're much more likely to have an uncontrolled limit of an environment. If you have a nice, healthy gut microbiome, then you're less likely to have problems when you're exposed to something. So that's just kind of food for thought. But as far as if somebody is going to get a vaccine, then you can say, well, these are the things that can make you to have a more effective vaccine. Maybe not the day of the vaccine or right after, but leading up to the vaccine, you want to be a regular exerciser because then you'll have a more robust response. The day of the vaccine or right before, watch something funny on TV. Don't go and do something super stressful and then go get a vaccine. And don't get a vaccine and then go to the gym. If you're tired after a vaccine, that means you need to go to sleep. They've done a lot of really good research on people that went to sleep right after getting vaccines, and they had a much better immune response. Having said that, also, if you did research on somebody that got a virus and went to sleep, they would have a much better immune response. It's just ethically unsound to inject somebody with the flu and then study their immune response, whereas you can inject them with a vaccine and study their immune response without getting sued. So that's why we talk about vaccines, but the vaccines can be just a space. It's the same as getting a virus, basically, as far as what we're talking about. The same things that make a vaccine more effective make your immune system more effective when you get infected with a virus, which is going to happen. That's just part of life. Taking probiotics. And they said, in the research, you don't just take the probiotics the day of and after. You want to take the probiotics for months before getting a vaccine or a virus. So that's why it's important that people are educated to be on some of these things as a part of their daily routine, rather than, oh, I got a problem, I'm just going to, whack-a-mole, tap it, take care of it right now, and then another issue pops up later. We have to this is a marathon, not a sprint. Leading up to a vaccine, and in general, avoid drinking, smoking, sugar, those type of things. And then it's amazing, some of the research on just these immune boosting adjuvants. Adjuvants are not always bad things. In vaccines, they use adjuvants like aluminum and thimerosal and even sometimes MSG to boost your immune system. But zinc and selenium can also be adjuvants, meaning that they boost your immune system. And guess what? They don't cause a lot of problems. In fact, they can dramatically decrease your risk for getting viruses, and not just decrease your risk for getting viruses, but in the study here about zinc, talk about how thymic involution, meaning your thymus is less likely to go away and atrophy if you have plenty of zinc. So we also discuss here how almost if you give elderly people 30 milligrams of zinc for 33 months, then a lot of them get to where they're no longer zinc deficient, but not all of them, meaning that zinc deficiency is prolific in this country, especially in the elderly. And this is the same at-risk group as is selenium deficiency. And these are key things, the research is clear that if we just made sure that everybody, including our elderly, had these nutrients, they would be less likely to have chronic infections and issues with their immune system. One thing I wrote here that I just have to kind of reference is in selenium deficiency, benign strains of Coxsackie and influenza viruses can mutate to highly pathogenic strains. Does that sound familiar to you? That is this whole nightmare we're in right now with the new COVID variant. Maybe if everybody was taking selenium and zinc, we'd have few of these variants going around, and then, we could get on with our lives a bit easier. So these are just some thoughts. The next slide that, I don't want to get too hyper focused on one specific nutrient. One reason it's easy to do that is because the research gets really hyper focused on one nutrient. But one thing that, I really like about systemic formulas and the products that Dr. Shane has formulated is that they they don't just look at a one nutrient, one mechanism approach. They're kind of trying to figure out all of the synergistic things that you need to make a pathway work. So, it's very obvious by the research that if you're low in selenium, you're going to have more immune issues, more diseases. If you have more selenium, less immune issues, less diseases, less inflammation. But I don't want to get too hyper-focused on selenium. I just referenced this because I think it's really important for people to understand how much information there is out there about some of these nutrients that are an important part of some of the products. Like G-Cell has a lot of selenium in it, and that's a great product. We'll talk about a protocol at the end, but that's a great product to make sure that you not only have enough selenium, but also that you have everything else that you need to make glutathione, because it's not just selenium. You also need a lot of other little nutrients. And if you don't have those, then you're potentially creating some other issues. Shane, did you have anything else you want to say about that before I go on to the next slide?
No, just that, your analogy with exercising, we have to exercise our immune system. It's clear that there's a number of ways. And when you talk about micronutrients like selenium and zinc, for those people that are really interested in the deep dive on that subject, both selenium and zinc have a critical role in maintaining our DNA integrity. And when you think about maintaining your own DNA integrity where you don't want it changing or mutating, which could lead to a lot of other issues, obviously cellular issues, where when our DNA is no longer being maintained and we have mutations, we can end up with cells that are aberrant and create a lot of problems in our body. When a virus uses the machinery inside of the body that also maintains its own DNA or RNA in this case, the not having those micronutrients around to maintain that DNA allows that DNA to change or to become full of mutations that can be both beneficial or not. But when they're beneficial to the virus, now the virus has a new version of itself. That's therefore these micronutrients, they work intracellularly. And that's one of the things that we try to, we strive to get enough of these micronutrients in the body so that each cell has the availability of these micronutrients, because you're going to prioritize, and someone that doesn't have enough is going to put those micronutrients in places that are more critical, and it's going to be lacking in places like the immune system because it's not an immediately critical need, whereas the brain is. So we want to get these levels up because we know how these micronutrients work to protect our DNA and, of course, protect us, against changing pathogens as well for the same reason. Those nutrients will help us protect our nucleic acids, for lack of a better word, but that's the science behind it, and which is why we want to focus on that in some ways.
Absolutely. So speaking of things that can change your DNA and cause problems, I referenced a research article here. It's from 2005, which is ancient by research standards, but I still think it's worth referencing. So what they talk about in this specific study is that thimerosal, which is made up of mercury, it still is used in some vaccines as a preservative. So it's not used as much, but they have replaced it with other things that are also problematic that maybe we don't think about as much as mercury and thimerosal, but are still neurotoxic. So it's still used in some flu vaccines that are given to pregnant women and the elderly, and it's still used in some flu vaccines and vaccines that are used in developing countries. So I know personally years ago when I worked at a hospital, I had to get the Hep B vaccine, and the vaccine that the hospital was giving everybody had thimerosal in it. So I just told them I was allergic to thimerosal, and they had to special order me the other one that was more expensive, but thimerosal free. And the lady was like, well, we've never had this problem before. Well, most people are not aware of what's going on, and what they're putting in their body is the problem. So my point is, you want to be paying attention to the ingredients, because some vaccines are cleaner than others. And if it does have thimerosal in it, then what's really key about this study is that it shows that if you prior to getting injected with thimerosal or mercury, so prior to getting a vaccine with mercury, or eating some tuna with mercury, or having your mercury fillings removed and getting exposed that way, or just having mercury fillings in your body and not having removed and getting exposed. Prior to doing those things, if you pre-treated with glutathione and NAC, then it had a significant increase in glutathione, and also a decrease. It prevented the cell death, the cytotoxicity, which is the cell death, when exposed to mercury. So this is really key. And so many people are low in glutathione. It's not as common of a test as vitamin D. We know from doing labs on people that vitamin D deficiency is ubiquitous. I would say that glutathione deficiency is ubiquitous too. And some of the genes that are associated with having issues with vaccines are glutathione genes, because they're essential for a tolerant immune system, detoxification, and health. So, as they say here, the potential protective mechanisms of glutathione and NAC against mercury toxicity warrants further research as possible adjuvant therapy to individuals still receiving thimerosal-containing vaccinations. So these adjuvant, why are they not putting glutathione in vaccines? I don't know. That would be great, but they're not. So G-Cell has NAC, which turns into glutathione. It also has glutathione. It also has selenium, and a ton of other little things that you really need to be able to protect your body from the cytotoxicity associated with thimerosal and the other thousands of chemicals out there that are cytotoxic and neurotoxins. So I guess I kind of am being repetitive here, but in this next slide, I just think this is also really important information that is straight from the literature. Like, this isn't me just on a soapbox making this stuff up. They're actually back in 1999 saying low dose supplementation of zinc and selenium provides significant improvement in elderly patients by increasing the humoral response, which means the antibodies in the blood. So there were more antibodies in the blood after vaccination, which means the vaccine worked better and could have considerable public health importance by reducing morbidity, death from respiratory tract infections. So that's kind of hitting home today, as we're all in our homes. But that could be flu. That could be coronavirus. There's a lot of respiratory tract infections out there, and selenium and zinc, as Dr. Shane Morris said, are key micronutrients for health. And the research is out there. We just need to start using it. So if you want to have a better antibody response, especially in the elderly, then make sure that you have those micronutrients.
You recall earlier, the geriatric population is a risk factor for many viruses, and that they don't always have to be such a risk factor. They can be. The geriatric world seems to be an under-recognized issue where, the population in your 30s and 40s and 50s, we can really relate to getting exercise and doing those things. But the geriatric population, one of the things when we were looking at some of the microbiome studies, is geriatrics tend to be treated as though they have to simplify their diet, simplify their probiotics and prebiotics that they use dietarily. And that's doing everybody a disservice, because the more you continue to treat your body the way you did when you were a little younger, the more education or the more resilience you're exercising your your immune system, as well as your microbiome, as well as creating, wanting to assimilate these micronutrients. And sometimes assimilation in geriatric populations drops. And partly because of all of the other choices we make in the geriatric world, that we want to simplify things, thinking that it's all about the macronutrients, when in fact it isn't. It's about the micronutrients. And, I would encourage anybody with a geriatric patient or access to geriatric patients that you rethink the paradigm, that they should be just as diet variation as everybody else. They should just be interested in supplements and micronutrients and working on their biomes, et cetera, because they're a risk population, partly because we've shifted our relationship to the elderly in that way. And we don't have to. We can reverse those trends and create that dynamic for them as well.
Absolutely. So I guess we need to kind of try to summarize and wrap it up. But there's one last slide that's really important. And this one is adversonomics and vaccinomics. So these are actual terms that, the scientific community uses. Adversonomics is the study of adverse reactions from vaccines, and specifically like looking at the genetic variants that are associated with adverse reactions from vaccines. And there's not as much information on these genes as there should be, and there could be with more data. I think my personal opinion is that one of the issues is that, if you're not really digging into who's having a side effect, then it's hard to then study the population of people that are having side effects. So that's part of the story. And then vaccinomics is where they're really trying to look at creating like a personalized health plan for vaccines, as far as what vaccines work with whose genes and that type of thing. I'm very skeptical of that because of the one size fits all, lowest common denominator approach to vaccines. Like, if we're okay with vaccinating a 1-day-old infant with a hepatitis B vaccine, then, why even bother looking at the genes if we're not looking at like the environmental actual risks? So those are just the terms. Now, there's in the studies that I found, and I was disappointed there's not more studies on it, but it's pretty clear that there is some good research that MTHFR, which is in Dr. Shane Morris's genetic test, and the IRF1. So IRF1 is interferon regulating factor 1, and that has to do with just immune response. And so there's specific SNPs there, genetic variants there, and then there's the GSTM1 deletion. So also in Dr. Shane Morris's genetic report. So if you are looking at some of these genes with people, then you can sit down and say, okay, well, let's just say you have these genes. So what does that mean as far as creating a vaccine plan? And some pediatricians are doing this. My daughter's pediatrician wanted to see my daughter's genes because of my personal history of having autoimmune disease. And then she did have a vaccine reaction that we were able to correct for, but it was related to low glutathione. So I put a question mark next to clotting genes because of some of the current questions out there regarding COVID vaccines, clottings, and issues, and COVID and clotting issues. I think, it's really important to look at people's clotting genes always, but especially when there is a virus that causes clotting problems like COVID. If there is a vaccine that's causing clotting problems, I would be really interested in knowing if those people have some of the clotting genes. So then the question is, what are the clotting genes? Well, the MTHFR C677T gene is a clotting gene. you are at a higher risk of clotting if you have that because you have higher homocysteine. And other key clotting genes that you can get from the systemic Dr. Shane Morris genetic test is the factor 5 and factor 2. So, another good reason to look at these genes and try to create, a real thoughtful plan regarding somebody's health. So, Dr. Shane Morris, did you have anything you wanted to add to that before we kind of go into an immune protocol?
No, I would just add that, when you do, one of the things that we should always now consider, because the technology is available, is running a genetic panel, because it does help you personalize your decision-making tree. You can now look at needs through genetic, these actionable genes, and not only make immune health decisions, but you can make decisions regarding clotting or methylation pathways or glutathione recycling, et cetera, because they're all interconnected. And it can be a very large topic. With the genetic panels, it allows you to break it down, compartmentalize it, and really personalize each patient's outcome. And I think that's where we're moving in the future with all these technologies. We can get more dialed into the patient than we could prior to having some of these technologies. So I highly encourage it. We have a genetic panel, but even if you have another one, someone else's, that's fine too, because you can help drive some of your decisions, or at least look at some of the areas that create a potential gap in what they need in their health transition, so to speak.
Absolutely. So as far as creating, an immune protocol, to some supplements that you could include to help boost your immune system, but also protect yourself from, having a problem with your immune system. I think we talked about probiotics being really key, and Systemic has, the tried and true NBC and ABC probiotic, but you have a new skin biome probiotic that, did you want to talk about that?
Yeah, although it has a lot of research behind it regarding the skin, I want to remind everyone that benefit to the skin is mediated through the immune system. And it is an ingested probiotic in that case, meaning that it's a probiotic that interacts with your gut and affects the gut-skin axis. But ultimately, it also affects just the gut immune axis, meaning that, we deliver some of our benefits through research to the skin. There's multiple benefits strictly to the immune system based on these probiotics. And I'm always an advocate of probiotic rotation, prebiotic rotation. So clearly, I'm going to advocate for a healthy variation of probiotics that we offer, and forthcoming ones, as well as prebiotics. And I think you and I talked about, we have FBR and we have L-Gut, and both of those are gut-driven formulas that help provide an immune benefit because of their benefit on the gut immune system, or the gut immune axis.
Right.
And then I guess we could even look now at the more, specific nutrient-based formulas like G-Cell, which you've mentioned a few times. So we probably don't need to review that much, but G-Cell has the benefit of precursors to glutathione as well as glutathione itself. And we did a study where we showed we could raise blood levels of glutathione in healthy volunteers. So we know that we've got it at a level now where each dose is high enough to where over 6 weeks we see an increase in glutathione, which was nice. That's important. You had some more ideas as well.
I think the DV3, which is nice because it has vitamin D, which seems like everybody needs, but then it's not just vitamin D. You also have the vitamin K2 and some vitamin A and some vitamin E. So it's really which are all important for your immune system. So it's really a nice fat soluble vitamin, but for the immune system. And then the CZI, which newly reformulated, that has a lot of vitamin C and then extra zinc. Right. So that's a great one as well.
Yeah, that's got the zinc, and it's got a lot of there's a few botanicals that are based on their research on viruses and benefiting our immune response to, a healthier immune response to viruses. So it's true. CZI has been redone to help address some of these immune health benefits, as well as, and I don't want the protocol to be too big, but when you look back, we've got now 6 formulas that we've advocated, and I can't remember if we had any more. Christy, can you remember?
The only other thing I was thinking is if you have a patient who's already taking neurovision, then you maybe don't need to give them as much zinc, because neurovision is, so important for elderly, preventing macular degeneration, and that has a fair amount of zinc in it too. So, that's kind of the nice thing about these products is they have a lot of different micronutrients and nutrients in them. So you can kind of look and see what that person needs, but definitely look at the gut probiotics, prebiotics, healing up the gut, making sure you have those fat soluble vitamins, maybe even the CVO fish oil, just to make sure your omega-3s are robust and not too much inflammation. But like you said, I don't want to make the protocols too high, but too complicated. But at the same time, it's important to have those nutrients.
It is. And you could even rotate them in. You could start off with 3, start off with the probiotics and the prebiotics, and then rotate in G-Cell and Neurovision and CZI, or start off with Neurovision, CZI. And so you can really, because there's the idea that not only do you need it and you want to get the levels up, so you've got a little bit of you've got a commitment to some time, as Dr. Christie said earlier. This is not, whack-a-mole, where we really want to set the tone to have people introduce these things into their life that they're going to be introducing from here forever, not thinking that they can deal with it for a few days and then, back to the old way of living. That's not the goal here. So you can phase these things in, and you can rotate them over time as well. Once you get their levels up, the D levels will rise, zinc levels will rise, selenium levels will rise. And then you can reach more of a homeostasis or more of a maintenance. And then you vary other things. So this protocol, though it's now 7 formulas, you don't have to do all at once, or maybe do all at once in the beginning and then, phase things. So I certainly advocate for doing this, but I also, practically can realize that there might be times where we want to vary things and maintain, what we call compliance with the patients, so they don't feel overwhelmed. And some people will have a reaction to supplements as they start to introduce them into their world and improving, your immune system. When you're starting to impact your immune system and make it function better, it can be reactive to things. The gut will react to certain levels of probiotics. So you might have to dose differently, because when you start introducing these people, maybe for the first time, they will sometimes have responses, and those responses, although can be a little bit scary for the patient, they will overcome them. They will go through, phases of dealing with it and getting used to it. And then you can alter it down the path, and they'll start to notice changes in their body, which I hope we all can say after we get a patient in a good place. They can start to really say, look, my allergies have changed. We've had a number of patients that we work with that went through the entire winter in 2019 without any colds that they used to get. They used to get colds, and now they no longer get colds. We didn't have access to them in 2020, but in 2019, we started seeing changes in these people that were otherwise not sure if we were doing, a really great job with them. And we started seeing benefits that they didn't really notice until they, looked back and recorded in their journal for us what they were doing. And these benefits are amazing. And oftentimes, though, there is reactions that they'll experience, but that you can push through them, and they're doable and maintainable.
Absolutely. Well said. So I think that this is a really important topic, and I think we did it some good justice, but there's probably more that we could talk about this topic. So thank you, everybody, for listening. And if you have any questions, then please reach out to Systemic Formulas, because they have a lot of really nice folks there that will gladly help you.
Yeah. Thanks, everyone. It was a pleasure.
Thank you. Bye.
Bye.